go ahead and show you how to put the paperwork in for our patients. So we do let the patients fill it out when they're new on their computer, and it automatically processes to their chart. Some patients will bring in the physical copies where we need to input them into the system ourselves. So we would do the scanning, then we would go ahead and click next onto this page. And this is going to be the consent. So we do have copies of the patient consenting to everything already signed. So we're just going to do it electronically now. So you put next, you're just going to go ahead and do the consent agreed. And then you can just put okay, done. And you're going to just do all the consents like that because we already have the patient's signature consents. There's a couple that we're gonna need to do. Once all those are done, it's gonna take us to patient information, which we will also have the physical copies, and we'll transfer them into electronic. Okay, this is where it would ask for the patient's photo. Since we're doing it for the patient, we're going to click skip. Once we go into the room, we'll go ahead and ask them to take a photo of them. Here we want to make sure that everything's accurate to what the physical copy is giving us. We're going to click next. We'll go ahead and put the patient's address, state, phone number, email, and we can put the preferred contact communication. Now a detail, when it's a suite and an apartment number, you can't put spaces, dots, or the number sign. So here I would just put, if it's apartment, you would just put APT. State.
403. This is exactly what the patient sees as well. So if they ever have trouble filling this out, you can walk them through it like this.
So we'll do 310
526 8301.
If they have a phone or an office, they can also put that, and they can also put email as well. This is how they heard about us. So if they heard from a family or from a friend, doctor, other patients, so let's put family, and here it gives them the option to put the name to thank for the referral. Here they'll go ahead and add emergency contacts. So you would just go here, type in the information, and then you press done, and it will take you to the next one. Here, this is where they add pharmacies like a CVS, Walgreens, Rite Aid, to when they want us to dispense the medications to those pharmacies. You would click here, type in retail or mail-in, and then just follow the prompt to look it up manually. Okay, you would need a phone number or the address of the pharmacy. If they have any allergies, this is where you would put them for the patient. So let's say this patient has allergy to adhesive and so forth. If you don't see any of their allergies here, you can always add a new allergy and add it in. Any medications that the patient is on, you would go ahead and put it here. If you cannot find it in this list, you can always add a new medication. Let's say the patient's on vitamin D3. Any medical conditions that they want to bring up that is relevant to their history. Let's say they've had a basal cell and they have eczema. If you can't find anything on this list that the patient has, you can always create a new condition. Any significant family history, that's going to help the doctor determine how to do the assessments for the patient and what to exactly look out for. Let's say this patient has a family history of eczema. Any past relevant surgeries, So if they had a basal cell, they've had an excision of the basal cell. And any, if they have any pacemaker, you can go ahead and click on that. Here, determine if they're pregnant or breastfeeding for females. Any history of exposure for skin tanning, excessive sun exposure. And they'll go ahead and ask them their smoking status as well. If you're not sure, you can always put unknown. And their alcohol use as well. Any recreational drug use. And health-related behaviors. This is to let us know if they've traveled abroad. And their marital status. If they had a flu vaccination. Or any other of these immunizations. After that, when it shows the congratulations, that means they're done. You go ahead and press done, and it'll take you back to the starting screen.